So I'm just recording. Yeah, the recording has been started.
Yeah.
Okay. So it's like a small podcast. It's the first time for me for hosting any podcast. So
Okay.
that's something I'm a bit nervous. Okay. So let me have a word. Today, our guest is Dr. Stephanie. Dr. Stephanie is NHS dentist and a private dentist, and she has been doing work with the charity van and have been working with the Manchester University as well. So, Dr. Stephanie, over to you.
Hi, lovely to meet you, and thank you for your time this morning. So, let's chat. What would you like to chat about today?
Yeah. So, to tell me about your journey, how you started, and what are your, the current schedule look like.
Yeah, so I've been a dentist now for 11 years. I graduated from Leeds University in 2015, and I did my foundation training in a lovely practice in Liverpool. So I did 12 months foundation training, and then I went straight on to become an NHS associate dentist. I then worked the next 8 years at a lovely practice in Birchwood. Had an amazing time there, had wonderful patients, wonderful colleagues. And really kind of found myself as a dentist at that point. And yeah, had a lovely kind of start to my career, really. Mainly NHS, but little bits of private things like aligners, whitening, concert treatments. But yeah, the bulk of my training and my career has been NHS. The last 2 years, I moved over to a practice a little bit closer to home, and I've now been accepted as an educational supervisor for NHS England. So I'm hoping to start that role in September, which I'm really excited about. And I'm just about to start, hopefully, a PG cert with Manchester University as well. So yeah, that's all in the pipeline. So there's been a lot of kind of new exciting changes coming up, which I'm really looking forward to.
Sounds great. So,
Yeah.
as you mentioned that you are in the NHS and obviously in the private practice. So, how do you manage? I know because that's a lot of work, right? How do you
Yeah.
manage? Because I've seen your content with the team and as well with the family, and that's a lot of do. So, how do you get the balance right?
I think I'll be honest, I don't think you can always get the balance right. I think sometimes things have to give a little bit, is my honest answer. But I think prioritizing what matters most. Diary zoning is a big one, so making sure that I've got allocated spaces for emergencies, for patients that kind of need extra support, for private treatments, so that actually my day can be really organised. And my reception team and my nursing team are fantastic in that way. So kind of making sure that my day is as predictable as it can be. That then means that things outside of work, so family commitments and everything else that kind of comes along, can easily slot in because the day flows well. I think that's quite a big one, but also kind of communicating with the staff that I work with. They're all great, so letting them know where patients need to be booked in and where time needs to be a little bit more flexible can also help as well. So actually communicating that, especially kind of if we know it's going to be a busy month, making sure that that's all in place, has been one of the things I've found helps the most.
Okay, yeah. And one thing more, I saw you post the detailed charity van. So how was the experience outside the clinic?
Oh, that was great. So I worked with Dentaid. I volunteered on one of their days. It was at a rehabilitation centre for patients who struggled with drug addictions, and it was great. It was really, really rewarding. The team were fantastic. It's certainly something I'd love to do more of. Yeah, it was great to kind of get out my comfort zone a little bit and work in a new environment. It was quite an exciting experience and just really rewarding. It was just lovely to be out and about. It was the charity just on a street. Great. It's good
I
that
think
Sorry, did it break up?
Think yes, there's a short issue in the
Oh.
connection. Let me see again. Okay. Yeah, Dr. Stephanie, can you hear me?
Yes, I can hear you. Yeah.
Uh, your video has been like a bit paused.
Oh, has it? It seems okay from my end. Is it?
Okay, let me. Okay,
Yeah.
no problem. We
Is it working?
can restart. Obviously, it's a podcast. Uh,
Yeah.
the next thing I want to, ask you about the school visits.
Yeah.
I have never seen people doing school visits,
Uh-huh.
mostly the dentists. Instagram,
Mhm.
they are doing these kind of things. So, what made you do these kind of activities, especially for kids?
Yes, so yeah, school visits are something I've done a lot of. I work with the same charity. It's Dentaid. It's their section called Bright Bites. It's a lovely charity, and they give us lots of support and resources. They allow us to go into schools and nurseries. For me, a big thing that I've seen during my career is that prevention really is key, and helping children to kind of learn how to brush well, to understand the implications of their diet, to kind of reinforce these positive behaviours at home. The younger we can start, the better. So children, when they come to see us, a lot of them already have decay in their adult teeth. And that can be a real problem. Difficult to manage. They might have suffered a lot of pain. They might have had days off school. They might have a diet that is full of refined sugars and fizzy drinks. And it's difficult then to kind of make these changes. We do it, and we get great results, but it can be a lot more of a challenge. When we're already starting from kind of on the back foot, really, as dentists. So one thing I've really kind of tried to do a lot of in my career is educating children as young as possible about the benefits of, good toothbrushing and a good diet, and how that can kind of create a healthy smile for life and create positive kind of attitudes towards attending the dentist and all of that. And some of the children in the schools and the nurseries that I've been to have never seen a dentist. They don't know what a dentist is. Some of them don't actually have access to their own toothbrush. And I think it's really important to make these small changes early on. So thanks to Bright Bites, we get to bring in toothbrushes and toothpaste for every child. So every child gets to take one home. Whether they've got one or not at home, they get to take it home that day. And there has been a fair few that hadn't actually had their own toothbrush. And that was just, really rewarding to know that we can start them and, give them a good chance to look after their teeth and hopefully have a really good positive future with dentists as well.
Yeah, yeah. Again, I will agree with you.
Yeah.
Mostly, we don't have awareness like
Mhm.
in the detailed way. When I started, I really don't have like informations, but now I have a lot of information about
Yeah.
dentistry.
Mhm. Yeah, definitely.
Okay, so moving forward, Dr. Stephanie,
Yeah.
what's your future plan for the clinic and for the growing with the personal brand?
Yeah. So now that I've kind of changed over to my newer practice, there's just so much opportunity to develop. So my main focus for the next few years is going to be my educational supervisor role. So this will be my first year. So there will be a lot to learn. I'm really excited about it. I feel, I've got the good qualities needed to be a great mentor, and it's something that I'm really working towards, especially doing the PG set, learning more about myself as an educator. So that will be really the primary focus, as well as obviously continuing with my own patients and kind of building on that as well within this new practice. So just lots of positive changes and lots of development. I've been a mentor for many years, kind of in an informal setting, so kind of supporting colleagues and helping to train dentists, dental therapists, and nurses. But it's nice now to have kind of, a kind of real, kind of confirmed role, like a more official kind of role in that sense, which will really give me that drive to kind of keep performing well and keep developing really as a dentist and an educator.
Okay, okay. Yeah, sounds good.
Yeah.
Before we wrap up, is there? I will ask question for the new dentists who are just graduating, because
Yeah.
I have few in my connections. Mustafa is obviously he's from Sydney, but he's a good connection of mine. So,
Yeah.
what are things he must, focus on in the starting year?
Yeah. In terms
So
of, is this a
that is,
foundation dentist?
sorry.
Is it a foundation dentist? Did you say, sorry?
Yeah,
Yeah. So what would be best for him to focus on?
yeah.
Yeah.
Like the starting years, the students
Yeah.
are quite, they don't have kind of direction. What
Yeah.
are the things like the time management or the stress management? What's the most one like challenging thing you have faced?
I think in your early career as a dentist, I think a lot of dentists feel like this is like they've got to do more and more all the time. So especially with social media, there's you could attend a course every single day if you wanted to. There's courses, there's people posting amazing cases. Colleagues that are, doing all sorts of things. And I think that the kind of best advice I could give to a new dentist is to just get the basics right first and to spend time doing that. My foundation trainer, when I first qualified, said to me that, don't run before you can walk. And it's a really good piece of advice in the sense of we need to know how to communicate well. We need to know how to do all of our treatments, any kind of NHS treatments first really, really well. We need to be good at taking teeth out. We need to be good at doing fill-ins. We need to be good at communicating that to our patients. And I think that can take a long time to get right. But once you kind of master those, and I guess we don't ever master it well. We're always kind of wanting to improve. But I think if you can get those things right first, that can take a number of years, and you don't have to sign up to lots of courses and post lots of things on Instagram to actually be a really good dentist. And your patients will start to know you, they'll start to trust you, you'll see your work. One of the things that I found is actually staying in a practice for a long time. You get to see what works well. You get to see actually what might not work well, and you can learn so much from all of those cases, whether they go brilliantly well or whether things don't go as planned. You can learn a lot just from your own cases, doing your own dentistry, and I think that's probably the best advice that I could give to somebody that's just starting out. Obviously, once that's kind of really, once the tone is set with that, you can go on and you can do whatever you like. There's so many opportunities in dentistry, but I think those early years is just getting the basics right.
Right, right. Very good advice for young people.
Yeah.
Stephanie, thank you so much for being here, and you are doing a really fantastic job with the community and the clinic. For anyone listening who wants to, follow your journey,
Yeah.
what's the best platform to follow you?
Yeah, so Dr. Stephanie McNamara on Instagram is usually the best one, and the same on TikTok as well.
Okay, okay. And where to reach out to you if they want to, through any email or just like a DM on Instagram?
Yeah, yeah, Instagram DMs are always open.
Okay. Okay, guys,
Yeah.
I will just, do the links in the
Yeah.
video at the end of the video. And thank you again for being here. It
You're
was a
welcome.
very big, okay.
Yeah, oh, you're
Thank
welcome.
you.
Thank you for your time today. You have a fantastic afternoon.
Thank you. Okay.
See you soon. Bye.
Bye.